Nausea and vomiting is commonly called morning sickness, and morning sickness is very common during pregnancy. Even though nausea and vomiting during pregnancy is commonly called morning sickness, it doesn't mean that you can experience this just in the morning. No, you can experience nausea and vomiting whether in the day or at night. You can have this at any time of the day during pregnancy. Hello. Welcome to my channel. My name is Bevelyn Ofori, and today's video we are going to talk about morning sickness during pregnancy. About 8 out of 10 women experience morning sickness during pregnancy, and for many of these women it is the first symptom of their pregnancy, and it means that most of the time a lot of women realize that they are pregnant when they start experiencing morning sickness. Even though symptoms of morning sickness usually start when you are around 4 to 6 weeks of pregnancy, you can also experience it sooner or later in your pregnancy. Morning sickness usually starts during the first trimester of pregnancy, and it gets better when your pregnancy advances or during the second or third trimester. But mind you, there are a lot of women who still experience morning sickness throughout their pregnancy. Everybody is different during pregnancy. So even though morning sickness gets better during the second or third trimester, there are other women who still experience it to its peak during all the 3 trimesters of pregnancy to the time they give birth. This is how it feels like when you are having morning sickness. You will sometimes have a strong aversion to certain smell and food. Sometimes you may dislike the scent of some certain food or smell. You may feel so nauseated or even vomit when you encounter those smells or when you eat those food that you have aversion to. You may also experience an on and off vomiting along with nausea lasting all day. Sometimes you may also feel very nauseated after waking up or after meals. So sometimes after waking up from your sleep, you may feel so nauseated that you may even vomit. Or after eating a meal that you don't like or a meal that you have aversion to, you may feel very nauseated and even vomit. You may also have a feeling similar to being car sick or seasick. Morning sickness during pregnancy is different with every woman, but there are some women who experience severe nausea and vomiting, especially if you can't keep down any liquid, which can result in dehydration. And when you are having these kind of problems, it can be very harmful to you and your baby during pregnancy. Remember to contact your doctor or midwife whenever you are having a severe form of nausea and vomiting and you can't keep anything down. Also, you have to contact your doctor or midwife when you are experiencing the following signs, and it may be signs of dehydration as a result of you experiencing severe form of morning sickness. Whenever you are passing only small amount of urine, when the color of your urine is very dark, if you feel dizzy whenever you stand up, and also if you feel like you are experiencing a racing heart rate or your heart is pounding very heavily. Some pregnant women can experience an extreme form of morning sickness, and this is called hyperemesis gravidarum. And this can cause these women to lose a lot of weight and also have issues with malnutrition, dehydration, and other health-related issues during pregnancy. It is very important to report anything to your midwife or doctor whenever you feel like you're experiencing morning sickness to the extreme. Morning sickness is easy to recognize during pregnancy, because it's a sign of pregnancy. Due to that, it does not require an official diagnosis unless symptoms severely impact your daily life or your morning sickness becomes so severe or extreme in the cases of hyperemesis gravidarum. So because a lot of pregnant women experience nausea and vomiting or morning sickness during pregnancy, if you are pregnant and you are experiencing morning sickness, you don't really require an official diagnosis because it's common for pregnant women to experience nausea and vomiting during pregnancy. But if you're experiencing morning sickness to extreme that it is causing you other health problems and also impacting your daily life as a result of that, then you can be diagnosed with hyperemesis gravidarum, which is the extreme form of morning sickness, and it may require treatment or hospitalization. The cause of morning sickness during pregnancy is not really known yet, but it is believed that it can be related to heightened sense of smell during pregnancy and also sudden increase of some hormones in your body during pregnancy. And some of the hormones that increase in your body during pregnancy are cortisol, estrogen, HCG, progesterone, and also prostaglandins. All of these hormones which increase in your body during pregnancy can cause morning sickness. Even though morning sickness is very common and a lot of pregnant women experience it during pregnancy, it is believed that some women are at high risk of experiencing morning sickness than others. Research has found that it is more likely for the following women to experience morning sickness during pregnancy. The first one, pregnant women who are expecting more than one child, all right? So if you are pregnant with twins or triplets, if you are pregnant with more than one child, it is more likely that you will experience morning sickness. The next one is if you have a history of migraines or motion sickness. So migraine is when you have a severe form of headache. If you are somebody who have issues with headache or migraines, it's likely for you to experience morning sickness during pregnancy. Also, women who have history of nausea when taking estrogen birth control pills. If you are on birth control pills, especially the one made with estrogen, and you have a history of experiencing nausea when taking those birth control pills, then it's believed that it's also likely for you to experience morning sickness during pregnancy. The other one is women who have experienced morning sickness in their previous pregnancy. If this is not your first pregnancy, maybe your second, your third, or your fourth pregnancy, and with your previous pregnancy, you experience morning sickness, then it means that in your next pregnancies, it's likely for you to experience morning sickness again. It's also believed that pregnant women whose mother experienced morning sickness during their pregnancy, it's likely for you also to experience morning sickness because your mother experienced morning sickness during her pregnancy. So it's likely for you to also experience morning sickness during pregnancy. These are just research that some people have done. So it doesn't mean that you may fall into this category if you are experiencing any of these. But what it means is that it's likely for these women to experience morning sickness during their pregnancy. But remember, morning sickness is very common and anybody can experience morning sickness during pregnancy.